Hi, everyone. Thanks so much for joining us. Hi, Michelle.
Hello, Anne. How are you?
I'm good, thanks. How are you?
Good, thank you.
Good. So, for those of you who are joining us, we are going to be chatting about acupuncture or sticking needles in our patients in all its different forms and presentations. So, Michelle's recently done a webinar for us on the Equine members portal,
Mhm.
the Equine portal, yeah, about acupuncture versus dry needling. And so, we're going to have a little bit of a chat about that. So if you guys are joining us and you can hear us, let me know. I don't see anyone live with us yet. Give me a thumbs up. Let me know where in the world you are. Michelle, how has your day been while we wait for people to come online with us?
It is 6 a.m., so my day is just beginning. So, yes,
I can never get used to that. That's crazy. My day's
so far so good.
nearing the end. Nearing the end. Oh, hi, everyone. Hi, thanks for joining us. Let me know where you are. Give us a thumbs up. Let me know you can hear us and see us clearly. And where are you? And are you excited about our topic today? What do you want to know? What are your questions? Give us a shout. Okay, so before we dive into this, I have a question to ask you guys. So first of all, we're going to be running a bit of a competition today, okay? And the competition is in line with our Vet Rehab Summit, okay? So if you guys don't know yet, we are going to be having the Vet Rehab Summit on the 13th of November, and it's all about research meets reality. And this is such an important topic. So today we are going to have a competition. We're going to ask you a question, and you can win one of Michelle's books, either the canine or the equine one, whichever one you would prefer. You can choose if you can answer our question. So Michelle, I'm going to ask you first, and then our audience can answer the question throughout the live whenever you get a chance. What is the research article that you reference most often when you're chatting to clients? Or what is the research that's made the biggest impact on your practice and your way of thinking? So you guys can answer either one of those questions. Michelle.
I think the way I'm going to answer that is that way back initially, back in the old days, Hillary Clayton was a big influencer of mine, especially for biomechanics and saddle fit and bit fitting, as well as the mobility side of things. So I reference a lot of her work. It's evolved as the years gone on, and I obviously reference a whole bunch of other people now that we have so much more research. But I would say Hillary Clayton was a major influencer for me.
I definitely can agree with that. So for you guys listening and watching, join in the competition. Let us know who do you reference most often. Is there a particular research paper that you love to refer back to, chat to your clients about, share with them? Megan mentioned that the one she used to use most often in practice was definitely one that talks about cruciate ligaments that will tear in the opposite limb like 60% of the time. So yes, that would be a good one to use. So let us know in the comments, what is the research that you guys reference most often, or that had the biggest impact on you, or has the biggest impact on you in your practice. Okay, so and you guys can win one of Michelle's books. So Michelle, let's chat about acupuncture. So first of all, traditional Chinese medicine, acupuncture, has a very long history and a very comprehensive approach. So what is that philosophy kind of built on? Give us a little bit of an idea, because it's quite complicated for someone looking at it from the outside.
So TCM is really a very, very special. It's really a special Eastern medicine. So it's been around for about 5,000 to 6,000 years. We don't honestly know, since before any of us were even an idea on this earth. And if you look back at some of the Bantu paintings in South Africa, they used acupuncture. It's used in other areas of Europe, as well as I think there was a link to the Egyptians. So there has been acupuncture for much longer than most of our civilizations have been here. And TCM, traditional Chinese medicine, really works on the principle of yin and yang. So it's really about creating balance in the body. And if we have imbalance in the body, we get dis-ease, which is disease. So really, it's all about the flow of chi, which is basically the body's innate and the life force within the body. And I'm obviously going to dumb this down really into small microcosms today, but traditional Chinese medicine really works on the principle of the five element theory. So, and the combination and the relationships within the 5 elements. So in traditional Chinese medicine, we have got 12 bilateral meridians that all represent a different organ, if we can call it that. And then you've got the unilateral ones, which is your conception vessel and your governing vessels. So, and that goes on the cranial and caudal, on the ventral and dorsal side of the body. So what effectively happens is when you are doing traditional Chinese medicine, you use a combination of pulses. You're going to use a whole bunch of different things in order to identify excess and deficiencies within meridians. And that results in that imbalance, which results in the disease process. So really, by understanding the relationship on a 5 elements level and on the meridian cycle, because at certain times of the day, the body is under more stress because of the meridian cycle, which is really cool to know, because then you can treat your patients much more efficiently if you understand the principles of TCM. So Chinese medicine is all about really just sedating and tonifying. So in other words, increasing something or decreasing something in order to balance out those meridians and have the correct kind of flow through the body without creating any issues.
Okay, so can I ask some questions now?
Absolutely.
All right, so I've heard people speak about pulses. What does that mean? What are you looking like? Are you just taking the patient's pulse?
So no, you're not taking a normal pulse. You place your fingers at a certain points to actually feel how the chi is moving through those specific meridians. So, for example, if we have a very slippery pulse, that can indicate that there's some dampness in certain meridians, depending on which pulse you're checking. So, identifying, like for a bounding pulse for that matter, is when the chi is very exuberant and it's overflowing. So we need to then go in and sedate that chi in order to balance it out so that it's not going, over the top. So it takes time. It's not the same as feeling like a normal pulse because the character of the pulse itself is so different and can be very pathognomonic of a specific issue that is going on in the body that we can then identify and treat correctly by sedating or tonifying.
Okay, so you're kind of feeling the character, like
exactly.
What is the pulse doing, right? Okay.
Yep.
I like that you're looking for too much of something or too little. Like it's not always too little. Sometimes it's too much.
Yep.
Very interesting. This is like definitely not something that I'm familiar with. So it's really interesting to learn. And talking about the 5 elements, that's earth, fire, water, something.
Wind and metal.
Wind and metal. I think Lisa Mason did a training on that in our business basic section, and it wasn't on that. It was actually about our staff. And she was talking about using the 5 element theory to understand different personalities and how we can better work together.
Yep.
Yeah. Very interesting. Very interesting. Okay, so let's talk a little, tell us a little bit about where does Western medical acupuncture come from, and what exactly is that based on?
So my understanding, and don't shoot the messenger here, is that Western acupuncture is not focused on the yin and yang, and they're not focused on the chi as such. They take a much more neuromodulation type approach. So it's much more about the nerve distribution and the way that the body reacts on a neural level to acupuncture. So based more on the direct and indirect effects that acupuncture is going to create such as extrasegmental analgesia, segmental analgesia, central effects, and we can talk about that in a second, which obviously is very focused on in TCM, but they're just taking the traditional stuff, I suppose you can call, out of it and looking at it from a much more scientific kind of neurological perspective, as opposed to working on the yin and yang and 5 elements theory.
So things that we can understand and grasp, and not like, yeah.
Yeah,
right?
So following more just like, I think with Western acupuncture, it has the same goals. It's just many ways to get to the same point.
Yeah.
And that's where things like dry needling are very much running parallel with Western acupuncture. And exactly what we're trying to affect with dry needling is what we're trying to affect with Western acupuncture. And dry needling in the US has a very, very different history and a very different procedure than what I got taught, for example, many years ago. And looking back, the way that we were taught was really, before Western acupuncture was a big thing, it's really the process that we were working with.
Okay, so tell us a bit more about dry needling while we're on that.
Okay, so dry needling is basically the insertion of a solid needle into a myofascial trigger point in order to create a catalyst of reactions in order to decrease that trigger point and allow it to go back to its normal tissue. And obviously we're dealing with pain control, we're dealing with all of those sorts of things at the same time. So it really correlates with what Western acupuncture is trying to achieve, which is basically, if we just want to go through that quick sticks, what that really is we're trying to create a pain modulation or a dampening of pain at the site by segmental analgesia, basically. You're trying to create also a kind of knock-on effect, not just at that specific point, but in the area surrounding that point, which is really extrasegmental. And then we're looking at so it's really the gate control theory, where you're dampening the descending pain pathways. And then you're obviously going to look for the wonderful endogenous opioids and serotonin and endorphin releases that occur with stimulating the body with needles. And there's a really interesting study that showed that sham acupuncture, when compared to traditional acupuncture, actually had really great central effects. So people felt better, irrespective of where they were almost sticking the needles. So, we get so caught up in where we're putting stuff that turns into a little bit of a panic. But intention and central effects do just as well if you're just stimulating the nervous system and the endocrine system.
I like it. So we have a comment here from Alexandra. She says she definitely loves making reference to Gillian Higgins and Jim Masterson's book Beyond Horse Massage and all of his work. Both of their work is incredible, and what a lovely live. Alexandra, thank you so much for joining us, and thank you for your entry. So to those of you who have joined us in the meantime and don't know why Alexandra would tell us that, we are having a competition. You can win one of Dr. Michele Broadhurst's books, which are about dry needling the myofascia. But she can tell us a little bit more about that just now. So the question you need to answer for us is, what is the research article that you quote most often, or what is the research that's made the biggest impact on your practice and way of thinking? And comment, let us know what those research articles are, and you could win one of her books. Okay, so I like that you've left off there, because that kind of leads me to my next point. Like listening to conversations about kind of one versus the other, I've often heard that people have experimented and said, well, you do Western acupuncture and I do traditional Chinese acupuncture. So let's compare where we insert the needles and what we do. And that's sometimes generally quite similar, right? They end up using quite similar points. So do you want to talk a little bit about that? How do they come to the same sort of things when the approach is so different?
So I think, when we're dealing with pathologies particularly, and we're not talking about, which is really I think what we're talking about is rehab practitioners. We're not going to be trying to change the integrity of the liver enzymes and all of that sort of thing. There is obviously that huge element to acupuncture, but definitely within our scope or our line, that's not really what the priority is. So if you look at meridians, a lot of them follow neurological chains and fascial lines and things like that, which correlates very much with Western acupuncture. So if you're going to be treating a dog for lower back pain, you're going to be going to the source of those issues, which is going to be a lot of your bladder points. And so in Western acupuncture, you're going to follow kind of that neural line. And it just happens that the meridians that we would probably focus on as far as traditional Chinese medicine follow a lot of those lines. Now, a couple of those points will be a little bit different depending on the way that you're schooled. So you may use a lot of the amphoteric points, for example, which in traditional Chinese medicine, it's basically all of your Jingwell to He points. And it's the same with in Western medicine, Western acupuncture, you may also use a couple of those really potent points to help increase the effectivity of your practice. So again, I think Western takes that kind of neuromodulation direction. So using segmental and extrasegmental analgesia as a lot of their focus if we're dealing with pain. In traditional Chinese medicine, we may be trying to dampen or tonify certain meridians, depending on what we find. And very often that's going to lead to a similar pattern, just using more the 5 elements and the meridian theory.
Okay. And dry needling?
So dry needling, you're going to follow the myofascial trigger points. Okay. And in a lot of cases, you're going to do a little bit of it, which is your segmental analgesia, basically.
Yeah.
And you're going to kind of create a stimulus, which is going to focus on increasing the uptake of the acetylcholine and changing the sarcomeres and things like that. And it's very targeted. It's very localized. But with that, you're also going to be doing latent and active trigger points. So you're going to be needling both the active as well as the latent. So that's your extrasegmental analgesia. So many ways to get to the same point. It's just depending on the technique that you use.
Okay. And are they quite different in terms of like the actual application? So are you putting it in the needle the same, stimulating the needle the same? Are there differences there?
So TCM and Western, you're going to use traditional acupuncture timing, I suppose we can call it. So you're going to have those needles in from anything from like 10 to 30 minutes in order to get those physical responses. And a lot of them use Electro Acupuncture, which also dampens even further the dampening effect by Malsigan wall, which is your gate control theory. So, and depending on the kind of acupuncture that you're doing, you can also kind of reconnect meridians in a different way. But yes, so there's kind of the time component with acupuncture. Western and TCM is very similar. When you're looking at dry needling, it's very quick. It's a couple of seconds, minutes at the most. To get a very similar effect that we're trying to create if we're talking about pain and neuromodulation.
Okay. And do patients happily lie still with so many, for 30 minutes with needles or horses? How do you keep them
still? Some don't. I think that's always the trick, is reading your patient best. And honestly, if you look at the really great acupuncturists of all time, especially on the human side, because that's where we can gain most of our knowledge, is all of them say really like where you're putting that needle, once that needle has been inserted, the time factor will change according to that patient. So with, like, for example, dry needling, you're in and out very quickly once you've acquired a twitch response and you've started that whole neuromodulation cascade. But with acupuncture, some tolerate it great and fall asleep and start drooling, and others not so much. So you just got to gauge your patient. And of course, there's other alternatives to needles too. You know, there's laser, there's shockwave, if we're looking from the just kind of myofascial side of things. There's acupressure. There's many, many ways to stimulate an acupuncture point that does not require sticking a needle in them.
We're going to talk a little bit more about that, I think. We have a question for you. So Stefania would like to know, regarding dry needling, do you always need to puncture the trigger point directly to achieve muscle treatment?
So again, if you're doing a kind of a focal, segmental focus, yes, you do. So you want to actually get into that trigger point so that you're changing the neuromuscular junction, which is changing the end plate noise and the cascade, so that you get that kind of breaking down of the trigger point and a reinstitution of normal tissue. And the twitch response is really important in order to achieve that, because that's one of our biggest time savers. That can really increase vasodilation and things like that. So ideally, you would like to target those trigger points. But again, you can also do some latent work.
Okay. And I mean, you speak about that quite a lot in your book. That's kind of the focus of your book, right? Is treating these trigger points or myofascial points with with dry needling or other ways of
things. Yes.
Different things. Okay, great. So let's talk about some of these different things, kind of starting with acupuncture, because, or I should rather say, actually sticking a needle into the patient, because there are so many things you could do with that. So you've already mentioned that we could run a current through, but a lot of people also inject fluids or some kind of like Tromiel or something else in there. So why would you inject something versus just put a needle in? And is there a difference in the effect that you have at the end of the day?
Well, it really depends what's in the needles. So biopuncture is what it's called. And some places they call it hydropuncture. But effectively what you're doing is you're going to insert either, it could be even lidocaine, so a topical, like an anesthetic, into that trigger point, which would obviously dull the pain sensations. So if you're a vet and that's in your scope of practice, that's available to you. But biopuncture is really helpful, especially with the homeostatic stuff. Like you mentioned, the Heal products are incredibly effective. Vitamin B is something that a lot of people inject into trigger points. And basically what you're trying to do is increase the vascularization in that area, decrease the pain response. So depending on what you're picking as the thing that you're going to be injecting with biopuncture, it's going to be very relative to what your outcome or what your goal is. So yes, there are great responses, because you're getting it right into that local area that is being affected. So if you're injecting analgesia or painkillers or homeopathic stuff, it goes right to the source. So of course that's going to be helpful.
Okay. And from a TCM perspective, do you ever do that? Do you inject things into the tissue?
Myself, no. I do know that some practitioners do some biopuncture. I don't personally do it, just because of statutes and scopes and things like that. But no, I don't. But a lot of acupuncturists do, if it's within their scope.
Okay. And then Electro Acupuncture, I always find that really interesting because it seems quite hectic to me. So standing from the outside and looking at it, I feel like that's a lot of stimulation. But I actually saw a really interesting video the other day of a veterinarian, I think, using it, and he was stimulating points around the sacrum and getting a response, like a muscle contraction within the triceps of the horse. And he spoke about that being one meridian, of which I don't know anything, but I thought that was really, really interesting, and how we could see the flow of energy and the connection through the body of places within the body that are not close together, that are not local to each other. So that was really cool. Why do we use an electrical current through those needles? What effect does that add or take away from just using the needles alone?
So it depends on which philosophy you're following here. So if we're looking at from a purely scientific perspective, it really is about dampening those neuromuscular junctions so that the pain receptors are being dampened quite significantly. So it's almost like playing broken telephone. You're decreasing the message as it goes down the descending pain pathway. If you're looking at it from a purely TCM perspective, it's about connecting various points together on the meridian to increase the effectivity of your treatment, because you're basically changing the resonance of the connection at different points.
Okay.
So, and again, this brings us back to there's many roads that get to the one place. So if you're looking at something like the bladder meridian, for example, which runs all the way down from the head all the way down to the sacrum, which is really the lower back of an animal. If you're going to use, those are fascial lines too. And there are myotomes and dermatomes that follow the same kind of pathway. So if you're using Western, you're going to look at things from a myotomal and dermatomal perspective, as well as obviously a neurological perspective, whereas you can get the same effect by just following certain meridians and using certain points from a TCM perspective. So it's pretty cool.
And then I must ask, can we achieve those same results if we use, if we're consciously choosing the points at which we put our TENS machine, for example, the electrodes on our TENS machine?
Absolutely. So like I said, there's tons of different ways to activate a trigger point. One of my mentors was always like, just take the back of a ballpoint pen and just stimulate that point. It doesn't matter. It doesn't have to be a needle. An acupuncture point is so superficial underneath the skin that's why acupressure works so beautifully. So it could be a needle, could be a laser, could be a TENS unit, could be a shockwave, it could be a piezoelectric little stimulus, could be anything. There's not a rule, and there's not a ton of research really that is showing that sticking needles in is the be all and end all. There's been a lot of research done that shows the effectivity of just stimulating an acupuncture point however you see fit has very much the same response as inserting a needle would too.
I actually have a question on that, but I will I'll ask Stefania's question first. So would you say adding to dry needling, for example, electrolysis, it could be much more effective?
Not necessarily. It may just decrease the pain response that you're going to get after the treatment. So that's why a lot of people will use an electrical current, is just to dampen the pain response for the post-needling soreness, as opposed to you're not going to change the effectivity of your treatment per se. So it's not like the trigger point is going to resorb much faster with electrical acupuncture, but the knock-on effect in the post-needling soreness will improve.
Okay. So then I would like to ask you, so you've now said that essentially you can stimulate those acupoints in many different ways. You don't need to use a needle. And there isn't a lot of research that kind of compares them to each other, right? Am I right in saying, do we know if laser stimulation is more effective than needles versus just acupressure? We don't know that.
There have been a couple of laser acupuncture papers come out that have shown it to be very effective. I don't think there's been enough. Acupuncture is fairly new to the animal world. And when I say new, it's only 20, 30 years where people have really been focusing on it. So I think the comparative research is not 100% out there yet. But it's definitely, if you look at the human world, you see a lot of correlation with acupuncture points and using different techniques that have shown them to be very equivocal. So, yeah.
Yeah, because this is really one of the most important things for us to ask, because for a lot of us, needling is outside our scope of practice. But we have laser units and we all have fingers. Our hands are already our greatest tool. So we always like to forget them and focus on all the gadgets and gizmos that we have, which isn't, it's not a bad thing, but we could definitely give our hands more credit. They deserve that. So if someone wanted to really to really use acupressure more, where should they learn about that? Well,
So
your book in the first place.
Thank
Yeah.
you, May. Selfless plug. Thank you. So it just really, like, the book really just focuses on our hypothesis of where in the last 20 years where I found these trigger points to be really active. So, and in bodies, they change all the time. So there's no hard and fast rule about where things are. Palpation is your greatest tool because you're using your hands and you're able to identify those points. So acupressure is fairly simple. I think the important thing is understanding pressure and time components, because you're trying to change that ground substance, especially when we're dealing with fascia. So, using it for a certain period of time, making sure that you have your hands on for the applicable time period, and that you're using an appropriate pressure so that you're not digging in there trying to get this, because you may create more trauma. So there are many courses. There's lots of other acupressure books which would be helpful. But really just learning the basics and then getting a feel, because you'll be able to feel that point release underneath your finger and the energy changes. So just really concentrating on your palpatory techniques is half the way there in being able to identify the issues that are going on and the things that we need to fix.
Okay, so Martina has added some depth to our conversation here. So she says that depending on the setting of the electro acupuncture, you release different hormones, and in a way higher amount than just with dry needling. So do you want to add to that?
So absolutely. So depending on what your settings are, you can obviously try to create a little bit more of a serotonin and endorphin response and an increase in your opioids. I think everybody is different, and according to pain tolerances too, you may, if you're dampening the descending pathways and you're stimulating these endogenous opioids, you are going to get a little bit more of a euphoric or less post-needling soreness. You are going to get that healing effect coming from those endogenous opioids, as well as all those lovely hormones. And, you also have things like the neurotransmitters, which are changing with electroacupuncture, but with acupuncture too, the same thing may affect, you may have the same effect. So there are some research papers which I've read, which have shown that there may subjectively be a little bit more increase in opioid release and hormonal releases. But for the most part, I think if you're really just looking at and doing the right things by the patient that you're doing, you're going to get a good response either which way, how you're going to get there.
Good. Thank you, Martina, for asking that, because, Michelle is talking to me who knows nothing about this, and then you've got to keep it simple, right? Or you'll completely lose me. So Michael says that Peter A. Jenkins may have some research papers on the laser component of Acu. I love just having Peter on social media, because he's always so open with sharing research and protocols and just helping when it comes to laser therapy. So thank you, Michael. That's a really great we'll reach out to him and see if he wants to share some of that. And then Michael also says that Tall Grass Resources have a course on acupressure. That's where he did his coursework, and it opens a whole new world of rehab. So that's good. Thank you. And Martina says also a release of stem cells.
That's true too, and your mitochondria. Yeah.
Okay, so Martina, our lectures might be more in line with what you already know. All right. So, okay, that's fantastic. So I think I only have one more question. So if you guys have more questions, please, now is the time to ask them. And before I ask that one, I'm going to ask you guys again. We are running a competition as we get ready for the Vet Rehab Summit. But in this live, you can't win a ticket. You can win one of Michelle's books. So either a hard copy if you're in the US, or you can win the online version. an ebook. The words are beyond me today. If you're outside of the US. So what you need to do is tell us which research paper you reference or cite most often, especially when you're talking to your patients, your clients, and educating them on what you're doing and why you're doing it. So what do you refer to most often? Or if there's a research paper or a series of research articles that have really changed your perspective, share that with us. I think one of the ones that come to mind for me would be in recent years Sue Dyson's work on the facial ethogram in horses, because I just think that in terms of driving home the fact that so many horses are unsound and in pain, it is invaluable to us as practitioners to be able to say, like, this is the look. I'm not making this up. Your horse is not being naughty. These are all pain signs. So to me, that's really valuable in talking to clients. So if you guys have questions, let me know and get your references in here so that you can win a copy of Michelle's book. My last question for you, Michele, is which approach or method do you think is best?
I don't think it's a question of what is best, like one being better than another. It really depends on what really suits you as a practitioner. And what you're trying to achieve. So everything's about goal and outcome-based stuff. So also it comes down to very much the time that you have to spend with your patients. You know, do you have 20 or 30 minutes, 45 minutes to spend in a consult? And if you do, that's amazing, you know. But for a lot of people, you can achieve a lot of really good things by doing kind of just the myofascial component, which is much quicker. But again, there are so many ways. There's no better or worse, and every practitioner needs to just assess that patient effectively and do what's right for them. Like you mentioned, not every horse can stand for 30 minutes with needles in them. And then there are some that can. So it all depends on the path that you're taking and what is applicable for that particular patient, and identifying that and treating accordingly.
Okay, fantastic. So hi, Megan from South Africa. Thanks for joining us. Stefania says she's not taking part in the competition because she already has your book. So yay!
Right.
Good. Yeah, I also have it already. I actually have the canine one and need to add the equine one to my library, but I'm going to wait until I can get my hands on a hard copy.
Bring you one.
Yes. So guys, thank you so much for joining us. And I think that it's fair to say that we have a winner to the competition. So Alexander Catherine Davies, well done to you. I will send you a private message and get your details, and we'll get that to you. All right. Thank you so much, everyone, for joining us.
Awesome.